Imagine a world where your body struggles every day to carry oxygen, the very thing you need to survive. A world where exhaustion, weakness, and constant medical treatments become part of your reality. This is the world of thalassemia, a genetic blood disorder that affects millions worldwide. But what exactly is thalassemia, and how does it impact the body? Let's dive in. Thalassemia is a genetic disorder that affects the way your body makes hemoglobin, the protein in red blood cells that carries oxygen. Without enough healthy hemoglobin, oxygen transport in the body is compromised, leading to severe anemia, fatigue, and organ damage. Thalassemia is not contagious, but it is inherited from parents. If both parents carry the gene, their child has a higher risk of developing a severe form of the disease. But did you know there are different types of thalassemia? Let's break it down. Thalassemia is classified into two main types, depending on which part of the hemoglobin molecule is affected. Alpha thalassemia, caused by mutations in the alpha globin genes. Beta thalassemia, caused by mutations in the beta globin genes. Alpha thalassemia, problem in the alpha globin genes. Your body needs 4 working alpha globin genes to make normal hemoglobin. The more genes that are affected, the more serious the condition. Silent carrier, where only one gene missing, no symptoms and no need for transfusions. A person won't even know they have it unless they get genetic testing. However, they can pass the gene to their children. Alpha thalassemia trait, where 2 genes are missing, causes mild anemia but doesn't require transfusions. Symptoms like tiredness or slight pallor are often mistaken for iron deficiency anemia. Hemoglobin H disease, where 3 genes are missing, leading to moderate to severe anemia. Since the body isn't making enough hemoglobin, red blood cells break down easily, leading to fatigue, pale skin, and an enlarged spleen. The bone marrow expands to compensate, causing bone deformities, such as a prominent forehead and cheekbones. Regular blood transfusions are often required. Hydrops fetalis, where all 4 genes missing, the most severe form, where no alpha globin is produced at all. Without functional hemoglobin, the baby cannot survive. This condition is fatal in utero or shortly after birth. Beta thalassemia, problem in the beta globin genes. Your body has 2 beta globin genes, one from each parent. If one or both are affected, it leads to different levels of severity. Beta thalassemia minor, 1 gene affected, a mild condition where the body still produces enough hemoglobin. No transfusions are needed, and most people live normal lives with mild or no symptoms. However, they may have mild anemia and should be aware that they can pass the gene to their children. Beta thalassemia intermedia, both genes affected, but some hemoglobin is made, leading to moderate anemia that may require occasional transfusions during illness, pregnancy, before surgery. People with this condition can still produce some hemoglobin, but their body struggles to meet its oxygen needs. Beta thalassemia major, or known as Cooley's anemia, both genes affected, no hemoglobin made, leading to the most severe form where the body completely lacks beta globin production. Babies appear normal at birth, but by 6 months of age, they develop severe anemia, extreme fatigue, failure to thrive, and bone deformities as the bone marrow tries to compensate. Without lifelong regular blood transfusions, every 2 to 4 weeks, the condition is fatal. Their bone marrow produces faulty red blood cells that can't carry enough oxygen. These cells are also fragile and break down too fast, a process known as hemolysis. This leads to severe anemia. The body can't keep up with the destruction of red blood cells, leading to weakness, fatigue, dizziness, fast heartbeat, pale lips and skin, cold hand and feet, shortness of breath. Bone marrow expansion happen in thalassemia. The body tries to compensate for the lack of healthy red blood cells by working overtime to produce more. This excessive activity causes overgrowth of bones, especially in the skull and face, leading to a chipmunk face appearance with frontal bossing, prominent cheekbones, and misaligned teeth. Thinning of long bones, making them more fragile and prone to fractures. Delayed growth in puberty due to energy being diverted to excessive blood production. Spleen enlargement, or splenomegaly, the spleen, responsible for filtering damaged blood cells, becomes overworked and grows abnormally large. This worsens anemia and increases the risk of infections. Currently, there is no universal cure for thalassemia, but modern medicine has given patients a fighting chance. Regular blood transfusions is the most essential treatment, replenishing healthy red blood cells. If a child receives timely and sufficient transfusions, their body will get the oxygen it needs, allowing normal growth, proper bone development, and the prevention of severe anemic symptoms. Iron chelation therapy. Since frequent blood transfusions introduce excess iron into the body has no natural way to eliminate it. Iron builds up, leading to severe damage to the heart, liver, and endocrine glands. Iron chelators are used to remove the excess iron. The key to a healthy life with thalassemia is early diagnosis, proper treatment, and consistent care. With adequate transfusions, iron management, and medical support, children with thalassemia can live active, fulfilling lives without the severe symptoms of the disease. Thalassemia is a hereditary condition, which means the best way to prevent severe cases is through genetic screening and counseling. If you or your partner is a carrier, a simple blood test can help determine the risk of passing it to your children. Raising awareness about thalassemia can help millions of people get diagnosed early and receive the care they need. Thalassemia is more than just a blood disorder, it's a lifelong journey. But with the right care, people with thalassemia can lead full and healthy lives.